My name is Dr. Praveen Rao. I am a joint replacement surgeon at Yashoda Hospitals, Secunderabad, and today we'll try to answer certain questions which are asked about joint replacement surgery. So what is joint replacement surgery? In a joint replacement surgery, the damaged part of the bone and the cartilage are removed and it is replaced by a implant which is called as a prosthesis. This is made up of metal, plastic and sometimes ceramic also. The other frequently asked question is which joints are usually replaced? The most commonly replaced joints in our country is the knee joint. So typically we do what is called as a total knee replacement, followed by the hip replacement and then by the shoulder replacement. The other joints which are replaced are the elbow, the ankle, and rarely we do joint replacement of the finger joints also. So the other frequently asked question is who needs joint replacement surgery? So typically joint replacement surgery is needed for people who have severe arthritis which severely affects their activities of daily living. They have a lot of pain, their functional ability is reduced, they are not able to walk, they are not able to do day-to-day activities. The common indications are for osteoarthritis, which is the degeneration or the wear and tear of the joints because of age. The other indication for surgery is rheumatoid arthritis, which is an autoimmune disease, and the other indication is traumatic arthritis also. So these are basically the three main indications for which joint replacement surgery is done. So what are the benefits of joint replacement? The benefit is that you get rid of your pain. The pain which was debilitating, which hampered your activities, which did not allow you to do your day-to-day activities, that pain goes off almost always. The other benefit is that your functional ability increases. You are able to walk longer, you are able to climb stairs, you are able to drive a car, you are able to do all the things which was not possible to do before the replacement. The other frequent question which is asked frequently is how long is this joint going to last? In general, your joint is going to last for about 15 to 20 years. But however, the longevity of the joint, it depends on many factors. One of the factors is how strong your bone is, how well you're using your joint, how well you're doing your physiotherapy. So these are all factors which will affect how long your joint is going to last. We have seen that at the end of 10 years, almost about 95% of the patients will have a well-functioning joint. At the end of 20 years, you have about 86 to 87% of the people who have a very good, well-functioning joint. The other frequent question which is asked is, what is a recovery like after surgery? So, once you're operated, generally we do these surgeries in the morning. By evening, you're back to your room, and that is when you will start your physiotherapy. So, in almost most of the patients, they would be able to get out of bed, stand with the help of a walking frame and take a few steps on the same day of the surgery. Immediately from the next day onwards, your physiotherapy intensity increases. You are started on knee bending exercises, strengthening exercises, and you will be given gait training where you will be helped to walk with the help of a frame. Generally, it takes about 3 weeks for you to start ambulating independently at home and start doing your day-to-day works. At the end of 6 weeks, you will be able to ambulate with a stick freely outside the confines of your house. And by the end of 3 months, you should be able to do almost all your things which you are able to do before the surgery, including driving a car and doing all your activities of daily life. It is said that for you to forget that you have a artificial knee joint, it takes about 6 to 9 months. What are the risks associated with knee replacement? Like any other surgery, knee replacement surgery is also associated with certain risks which are called as complications. The good thing about complications is that these are very rare and they account for only about 2 to 3% of the cases. The commonest risk which we encounter is infection, which is quite dreaded. We do all it takes to make sure that the infection doesn't happen. We operate in world-class laminar flow, zero bacteria theaters. We use antibiotics, and our surgery timings are also pretty less. So this goes a long way in reducing the risk of infections. The other complications what you can get is blood clots in your veins. Sometimes your joint can become loose over a period of time, and there's sometimes, especially in patients who have autoimmune disease, there might be some wound healing problems.
Like, comment, and subscribe for more health updates.